Awareness of our mental health. It is a topic that has really come to the forefront during the pandemic, as we all have faced enormous challenges with fear, with depression. It's been a very difficult time. And really, Sean, the time is better than ever for us to communicate more about this very important issue. We have a doctor standing in the wings who'd like to do just that.
Absolutely. Is there a doctor in the house? There is now. Dr. Jeff Morosky. He is
Ha!
the Chief Medical Officer with SilverSummit Healthplan. It's great to have you, my friend. How you been?
Hey, it's great to be here. And it's nice to talk about this issue that's been with us from before the pandemic, but unfortunately, the pandemic has made it a little worse.
Oh, yeah.
September is Suicide Awareness Month, so it's a
Mhm.
good time to start the conversation again.
Yeah, especially over the past, 20 months or so, my goodness, it's been a mental health stress test. When you're looking at people that you seem to think that are just like A-OK and they're having a tough time, it's been a tough 2 years or so. Let's talk about suicide prevention and why the focus on it is so important.
This is an issue that's been with us for a long time and continues to be an area of focus for healthcare providers. We have to do something about it. And as a health plan, we look at it and say, what can we do? Well, one is really try to find people who are at risk, use the data that we have to kind of identify them and share that with our provider partners to help them understand how to reach out and help people do that, connect them to the resources that are there. But beyond doing that, the other part of it is that suicide prevention is a village activity. It takes the whole community. And so we need to raise awareness of what we all can look for to help connect people who may be at risk for suicide or suicide behaviors.
It's just what I was thinking while you were speaking, Dr. Morowski, is it really takes not just your doctor, it takes your family member, your coworkers, your neighbor, and it takes us all taking a look inside ourselves and realizing that, struggling with depression is a very, very common situation, struggle to be in at some point in your life. And there is more help than ever nowadays. I think that the stigma, from my point of view, the stigma of being depressed is
Yeah.
a lot less nowadays than it was, say, in my parents' generation.
It is, but that stigma is still really important. And the fact that, we don't stigmatize people who struggle with controlling their blood sugars or their blood pressure or their weight or any of those other medical conditions, but yet we stigmatize mental health.
Yeah.
That's something we have to get over as a community. And so we're hoping that, outreach and helping people recognize those risk factors and seeing them will help the community kind of address this horrible disease that impacts people, their families, the coworkers, and the whole community.
Let's talk about Silver Summit Health Plan and how you are putting a spotlight and raising awareness on National Suicide Prevention Month.
Part of it is, making sure people are connected and doing things like this, saying, hey, listen, if, you're interacting with someone, a family member, a friend that's hopeless or helpless or is really had a lot more social isolation, even more than in the pandemic, those are things you need to reach out and ask, are you okay? And can we get you to help? Suicide prevention NV.gov, one of the websites, silversummithealthplan.com has resources. The National Suicide Prevention Hotline, 800-273-TALK. We want to get all those resources out in the community and make sure our providers know about them and our community knows about them so everybody can help address this.
Yeah, certainly. And doctor, I raised the term depression because I link those two. But in fact, I think leading up to suicide looks very different for each person. But in your experience, there is a period of hopelessness before the
Mhm.
actual suicide or
Yeah.
attempted suicide happens.
Yeah, what we want to look for in people are those signs beforehand. And so it can be things that are more depression looking, like hopelessness or helplessness, but it can also be kind of severe anxiety, starting new substance use. That's always concerning.
Hmm.
There's a number of behaviors, being withdrawn, even more so in the pandemic, not even Zoom connecting with people. All of those things, any of that major change in behavior, those are all risk factors that we want to make sure everybody knows about. And it's a good time just to ask, how are you and are you okay? Can I, what can I do for you? And if you have someone that refuses to connect, escalating that to their other connections and family members and loved ones and pastors. And if it's in kids, their teachers, making sure everybody is connected to this and that it's okay. It's not off limits.
Yeah. Dr. Morofsky, great having you as always. Thank you, my friend.
Thank
Thank
you.
you.
All right, the National Suicide Prevention Hotline. It's 1-800-273-8255. Anytime, day or night, 24 hours, it is open. You want to learn more about Silver Summit Health Plan, go to silversummithealthplan.com.